Hi everyone, it's Dr. Garza here. I'm checking in for tonight's Facebook Live Q&A on anxiety in teens. This is obviously going to be pre-recorded and shared with my Shauna Garza MD page, and will also be shared on the Girls to Women McKinney Facebook page. I welcome any comments or questions you have along the way. I have a few things I'd like to go over regarding anxiety in teens. Hopefully it's helpful information that will help you with your own children and family members, and kind of being aware of how anxiety affects teenagers. As I mentioned earlier today, anxiety has been high right now during quarantine time. Many patients are feeling stressed about keeping up with school. Maybe there's family stressors going on related to financial concerns, health concerns. And even before quarantine, this anxiety has been a real issue for many teenagers. Starting down even in the 4th and 5th grade years. I started seeing patients at age 10, and I've had many patients in the elementary school years that are dealing with anxiety. So, how does anxiety look in young teens and young adults? Very few patients come in saying that they feel worried. So it's important to recognize both physical and mental health symptoms of anxiety. Physical symptoms might be a patient that's got frequent nausea, frequent abdominal pain, that especially doesn't, have other explanation. Maybe it's abdominal pain when they're stressed. Maybe it's before going to school. Physical symptoms can be chest pain, heart palpitations, like their heart's beating too fast or too hard. They may feel short of breath. I've had patients feel dizzy, where they're concerned they might faint from these physical feelings. They can also have sleep problems. Sleep is, directly how mental health relates to physical health. And so sleep issues with having a hard time falling asleep, staying asleep, is often a physical sign of anxiety. There's also, this just kind of overall fatigue. And then I talk to patients about what their body's going through when they feel these physical symptoms relates to an internal stress response. Many of them may have heard, or if not, I talk to them about what it means when your body goes into a fight or flight mode. And so essentially your body is accelerated with fear. And, we have kind of a little expression in our office that back in caveman days, your body would feel fear because you needed to run fast so you weren't eaten by a tiger, for example. Well, now those aren't the kinds of fears that we're feeling in our life. And so it's not true. Most of the time it's not, physical fear that people feel, but it's, more of these emotional fears and just other things going on with school and life. But their body goes into that accelerated fight or flight response, and that can feel very uncomfortable. It can be distressing. And we recognize that. That's often what I'm doing in my work, is having families come in with these concerns. And, to me, I'm always have that in the back of my mind. Of course, I don't want to, chalk up all upset stomach and nausea to anxiety. It's my, diligence as a physician to look for other explanations and causes. But it's important to realize that anxiety can have a physical manifestation. On the mental health side of anxiety, patients can feel worried, worried about many different things. They may feel overwhelmed. They may feel irritable. Irritability is very common in anxiety. And so sometimes it's hard for parents to know, is this normal teenage kind of relational irritability in the home or with siblings, or is this something more significant? And so I would say it's irritability with pretty much all relationships, or irritability that's really affecting the patient's, connections with their friends, impacting their behaviors, where it's, you know, more serious than some of the maybe usual attitudes you might feel with a teenager and parent relationship. Patients can feel fearful. I've had patients with phobias that are like specific fears, but overall, sometimes they just feel something really bad is going to happen, the sense of doom. They worry, they hear news stories that they really internalize. They worry about, you know, bad weather. They worry about now COVID. They worry about, you know, before like school shootings and terrorism and things that they hear, they internalize. And so feeling fearful is a mental health symptom of anxiety. Concentration can be affected. They may have difficulty concentrating on schoolwork. That can affect their performance in school. Of course, there's other things that can affect a concentration, and you know, I talk about my evaluation and treatment of ADHD, but you know, new symptoms of poor concentration often are related to anxiety. Patients may feel like they have racing thoughts. They can't stop their thoughts. The thoughts are, you know, kind of very chaotic or frequent, and they have a hard time turning their mind off. And then some patients will feel hypervigilant. Hypervigilance is where, you know, you have a big response to little things. And so, you know, they get very moody with things, or small things kind of set them off. And they're also just very fearful and worried about things in their environment. And often it's things that are beyond their control. So, you know, that can be very distressing. These are symptoms that cause patients a lot of distress. And so, you know, things to look for are how it affects a patient in different areas of their life. We often will talk about the spheres of a patient's life, whether it's school, home life, social life, as kids get older, work life, their other activities. So in school, anxiety can affect their attendance. We had many patients with school avoidance, and these are students that are having a hard time getting to school because of the level of anxiety they feel there. Some of that may be situational related to like a certain drama or even bullying, or maybe, you know, how things are going in a certain class, but it does affect their attendance at school. They may have panic attacks at school that are very distressing. They get real embarrassed by them. They don't know where is a safe space to retreat to. I've had patients report to me that they'll, you know, miss a class or be late to class because they're in the bathroom very upset. And that's really hard. It's really hard, you know, especially when you're, you know, working towards independence and you need to be at a different class every hour, and just managing all that can be really hard with anxiety. And then, you know, this affects their grades and their attendance. And so, you know, if you're late to classes because of this, if you're late to school because it's hard to get to school, if you, you know, aren't able to keep up with work because of difficulty with concentration, then it's a lot to manage. And so, you know, grades can go down, attendance can go down, and, you know, that's often maybe the first thing parents notice, right? Parents notice, especially like in a high schooler, that they're said, well, you know, grades were fine before, now they've really having a hard time keeping up. What's going on? And then in school, we also get concerned when patients are isolating. Maybe they're, you know, kind of pulling back from activities they enjoyed before, or their social life at school. And, you know, we see this in depression as well, but how it affects patients in anxiety is they're just feeling overwhelmed with managing what they have to do in life. And, you know, I probably should have prefaced this at the beginning of this discussion, but I do think that high schoolers now are managing way more than any other prior group of students. And this has been a trend for the last several years, but the amount of pressure that high schoolers feel on their grades, on their GPA, on their class rank, on their you know, SAT score, there is so much pressure that they feel for the academic side of school. There's a lot of worry about college. There's a lot of worry about financial aid, scholarships. And then on top of that, patients are very busy. They are committed to many different activities, sports, work, other school activities. And so I think it's just a lot for, the average high schooler to manage. Life in high school looks a lot different than it did at the time of most of my teens' parents. And I'm probably more in that generation now. And so it's just a lot that we're asking of teens to manage and understanding the kinds of pressure that they feel. And so, this is something that I think school is a big source of anxiety, but it's also just realizing how much pressure they feel in that environment. So in family life and at home life, anxiety can affect patients where sometimes they're fearful to leave their home. They're, whether it's because of the bad things that happen outside of their home, or whether it's just social anxiety. I have patients that isolate and stay home. Now, that's not what's driving kids staying at home right now during quarantine. They are staying home because they, parents are telling them, and those are the rules right now. That's a little bit different, the situation we're in right now. But in general, if teens are feeling like they don't have kind of the energy to leave the home, or they're fearful, that can be a sign of anxiety. And then again, that irritability in the home environment can be related. I did want to talk about situational anxiety. I do have patients that feel that there are definite certain triggers of all of those physical and mental health symptoms that I mentioned, whether it's social anxiety. That's something that we talk about a lot. There's patients that really struggle with meeting new people. They struggle with being with a group they don't know. Maybe they struggle with being in crowds. And high school's crowded. They're big schools, especially in Allen, for example, and McKinney. The high schools are big, and so just even the passing periods are really hard for some patients that have social anxiety, because of just feeling kind of crowded, and it's loud, and there's just a lot of people around and close to them. Can be a lot to manage. And social anxiety also can affect, friendships. So people can just have a really hard time connecting with others. And this is not autism spectrum. These are patients that really want connection and they want to be part of a group. But they have a hard time because they are, fearful of judgment, or they're fearful of they're not going to say the right thing, or they don't know what to say or how to say it. And so that can really affect them. Other situations that we see in high schoolers specifically are related to academics. So I have many patients that feel like they have test-taking anxiety, public speaking, presentations, performance, those types of things where they feel like there's a lot of eyes on them, and there's fear of judgment, or not doing well, or not saying the right thing. And that those are sometimes can be kind of usual reactions that we all can relate to. But when it is something they feel so much physical discomfort that they can't get through the situation, or it just becomes overwhelming to them, that's when we worry about how can we help them manage that and feel better in those settings. I was going to mention just one last situational trigger, and that relates to cleanliness. Some people, have a lot of struggle with germs and cleanliness, and right now with COVID, that can be very triggering, because these are hard times. Knowing that you have to wipe everything down from the store and wear gloves and wear a mask and all the sanitizer. That can be, very triggering to someone that has high anxiety about those types of things. So I did want to talk about, these are the signs, and then it's, what do you do? How do you get help for your teen? Of course, at our practice, we're, very well versed in talking to families and patients about these concerns. And what we will recommend is kind of a combination of things. I always tell people there's not one right answer. There's not only one answer. I want families to feel comfortable. I want patients to be on board, and understanding that the different things we offer are different tools that help people manage. And so, we talk about coping. I mention this a lot on social media, and I try to kind of be a role model for that as far as building healthy ways of coping. So, you have this emotion, you have this feeling, whether it's a physical feeling or an emotional feeling. How do you cope with it in a way that is healthy? Part of it is taking good care of your physical body. So I talk about sleep, sleep, sleep. Sleep is so important for teens' brains that affects their mental health and their physical health. And so patients need to be getting adequate sleep. And we talk about that, how to get good sleep, helping them with that if they need it, with even melatonin and other things. Then we talk about daily exercise. Exercise has a role for coping. I feel that as an adult, that it is a great outlet for managing stress. It's a great health habit for teens to build and really turn to exercise, not for how many calories they burn, not for any competitive reason, but for a way to manage stress. And so that can be a great way to build coping. So again, taking care of the body is exercise, sleep, and adequate nutrition. And so, we know, like, if you're not well fed, if you're skipping meals or you're eating a lot of kind of processed foods or foods that are not providing you good fuel, that can lead you to feeling like easily overwhelmed and not being able to handle things. And so, good nutrition is an important part of self-care. As far as other coping strategies, we do talk real actively in our practice about deep breathing. There are great apps that can teach that. There are exercises. A lot of it's yoga-related breathing. So the one app that most people know about is called the Calm app. And that is one that goes through all kinds of different exercises with deep breathing and relaxation. There's also meditation apps, Headspace, people have heard of. It's free. You can, take time. I tell patients, it could be 3 minutes of your day that you work on mindfulness. You work on creating calm, knowing what that feels when your brain is calmer, and then using deep breathing to slow down that internal fight or flight response. These are things also that a therapist can teach. And so, I go over it a little bit in my office, in my visit. There's a lot I'm going over, as you can imagine, but that is something that I do talk about with them. There's other things as far as outside time. I'm a big advocate for getting outside and getting fresh air. That can be walking the dog, that can be, exercise. It can just even be sitting outside and getting some fresh air, listening to the birds, getting some sun. I think there's real value to that for patients' mental health, especially if they're like in a mode of getting, real kind of overwhelmed. Taking a break outside, maybe playing with their dog, petting their dog, throwing the ball around. Those are all really healthy ways of coping. There's also journaling, there's drawing. Some patients like kind of creative outlets, even like adult coloring books. The idea with that is that you are just kind of taking your mind off, focusing on something else. Some patients, they take baths. Baths is their way to relax and cope. Talking to a friend, taking a nap. These are all healthy ways to cope with emotion, and so, or even physical feelings. So I really want patients to identify what works for them. It's not one answer, but being able to say, okay, when I feel stressed, I turn to this, and this helps me feel better. And then we're big advocates of therapy. You've heard me say this before. We have 2 therapists in our office, and they both work with patients starting at young ages, but through the teen years. And the idea with that is to help them build ways of coping and to understand how the way they feel can affect the way they act in the world, their behaviors. And so understanding those connections can really lead to recovery. The main form of therapy that they use is what's called CBT, and that's connecting how your thoughts and emotions affect your behaviors. That's kind of in a nutshell. And then for anxiety, we also talk about medication when it's appropriate. I use different medicines. I use medicines that work on brain health and brain chemistry. I work on medicines that block that fight or flight response. I work with medicines that, kind of help take the edge off when they need it. And so, medications can be very helpful for patients. And we say, they are one tool. They are not magic pills. They have to be combined with these other strategies I've just talked about because, it's not just the only answer that's going to fix their problems. They really have to work on building ways of coping. So medicine is a part of our work, and that is something I'm very comfortable with. I always guide patients through that and help them understand that that kind of our approach is always to start low and slow and steady, meaning that we want to monitor, we want to start low, we want to kind of see how patients do. So that's always my approach. And then one last thing I'd like to just mention is when patients have anxiety that's affecting them in school, we will help them get accommodations. Accommodations at school can really help them stay in school and be successful. And so that's done often through a 504 plan. You might have heard of that for your student for other reasons. Many patients think of it for ADHD, but for anxiety, it can mean that they can take breaks when they need. Like if they need to be a little late to class, they can do that. They can go to the counselor's office when they need. And so it helps patients feel like they have a safe space at school. And so I just want to let parents know that's available in most high schools, and I will advocate for my patients to get that help, just to help them through this time while they are working on these other things, getting on the right medicine, getting the right therapist, and then also, building the coping strategies. So that was about 20 minutes. So I hope that was helpful to you all. Again, this is just kind of a main part of the work I do right now. And so, I'm happy to speak with you offline or send me your comments after you watch this video. And I'm happy to see you in the office. So I hope you all have a great rest of your night and take care. Bye.